So we're trying to explain the whole concept of what hormone replacement therapy, right? Where you hear, right, doctors talking about HRT, right? Hormone replacement therapy. So just like the way the name implies, somebody lacks a hormone, so I'm trying to give them the hormone. Do you understand? There could be different reasons for this. So for here, we are talking about mostly estrogen because it's women stuff we are talking about. You understand? So it's a treatment, because you want to relieve symptoms of menopause. You understand? So it's basically hormone therapy, for women. Okay, hormone replacement therapy for women. All right. So you want to replace what hormones that are lacking. So for a woman that has hit menopause, she's lacking what? Estrogen that is usually in a young woman. She's lacking progesterone that is in a young woman. You understand? So the body, when the body hits menopause, pause, something is pausing. All right, hormones like estrogen, like progesterone, they are no longer being produced well again. All right, so so you basically replace hormones basically to treat what issues that come with menopause. So things like hot flashes, things like night sweat, things like vaginal dryness, things like mood swings, things like sleep disturbances, things like urinary discomforts, things like bone loss, osteoporosis. The bone is becoming soft. All right. So it may also be used in younger individuals with premature menopause or hormonal deficiencies. So types of this hormone replacement therapies just include, it could be only estrogen, so they call it estrogen-only. All right. So this one is used for people that maybe they have undergone surgeries, that they have removed their uterus. Combined hormone replacement therapy. This one is estrogen and progesterone. This one they are used with an intact uterus just to prevent endometrial cancer. Systemic one, all right. So hormones circulate throughout the body, all right. So they're available in pills, in patches, in gels, in sprays, in rings. They'll have the local ones, all right, available in creams, in tablets, in rings. And put a ring in the vagina. So what's the benefit of me replacing hormones back to you if you lack them? All right, so there will be relief from all those symptoms that come with some hormones being little in the body, like hot flashes, night sweats. There's improved vaginal health and sexual function. There's reduced risk of your bones being too soft, because those hormones are needed to keep your bones intact and avoid fractures. All right, there's possible mood or cognitive benefits. There's improved sleep qualities. So risks and considerations is it's not suitable for everyone. All right, so sometimes those hormones, they have their side effects. The breast doesn't have to be exposed to them for too long, even as they benefit other organs. You understand? So if the breast gets exposed to them for long, it becomes cancerous. Blood clot, there's stroke, there's heart disease, there's bladder disease, there's endometrial cancer. Right? But these risk factors depend on what? The age of the person, depend on the type of therapies you are giving and how much you give it. You understand? Depends on personal what attributes to the person. Then also depends on the family history of the person. Do you understand? You are trying to ask, like, somebody in your family ever had this type of issue? How did they treat the person? How did they end up? You understand? So those are all the questions you ask the patient as they actually come in. So that was what hormone replacement therapy for menopause simply means. Sorry, I didn't include menopause here, but in naming the video, I'll put menopause there.